I'm having problems with my audio earlier. Okay. See, for today, we'll have a discussion on nutrition. But before that, what I want you to do is, if you have an extra gadget, maybe you can access this website, vivox.app, and then type in this ID number. Can you guys do it?
Yes, sir.
Okay. Sige, I'll wait for your when you sign in before we start. Sige. Only those if you have an extra gadget. But if none, sige, it's okay. You can just look at this slide in the Zoom. Okay? Sige. Have you entered the ID? Yes or no?
Yes, sir.
Yes. Okay. Sige, let's try ha. Let's try this one. Okay. So, let's try to answer. So, for this one, who is Batman's alter ego? So, choose any of the choices. Okay. So, who answered Ralph Jacinto? That's incorrect. Okay, let's stop this. Okay, so yeah, okay, good. You're able to access the Vivox app. Okay. Um See, let's we'll be back with the Vivox app later on. Okay, so for today you will have your nutrition. So objectives would be will describe the three major classes of essential nutrients. So basically this is like a review of what you have learned previously. So when we talk of the essential nutrients, these are your carbohydrates, lipids, and proteins coming from the diet. And then we will also look at the factors affecting the required nutrient intakes as well as what we call as your nutrient requirements. So these are a set of standards that we use or that we look at in order for us to determine if the level of the nutrient is enough or if it's over or if it's less. Okay. And then we'll also look at the different forms of malnutrition. Okay. Wait, I think I have a poll here. Sige. Okay, let's look at the next poll. So this one, so type in your answers. So nutrients are defined as blank. Okay, let's look at your answers. Okay, someone answered food, components. Okay, what's food? Okay, compounds. Okay, okay, something that is to be provided, energy, micronutrient. Okay, nourishing. Okay, so I got the word that is somewhat important. So I'll close this one already. Okay. So I think the more important terms here would be you have coming from the food, you have the essential, the word essential, components, and beneficial. Okay. So let's look at the definition of your nutrients. So nutrients, these are food constituents or components coming from food that are necessary or essential in order for us to sustain our normal bodily functions. Okay, so this can be divided either as your macro nutrients, meaning we need to take it in large amounts. That's why it's macro. So these are your carbohydrates, fats, and proteins. And then we also have the micronutrients. So micronutrients, these are your uh, nutrients that we need to take in smaller amounts compared to our macronutrients. So these are your vitamins and minerals. Okay, okay. Sige, let's go to the um, VVOX again. So, so why do we need carbohydrates? What is it for? Okay, so kindly type in your answers. What would be the primary function of our carbohydrates? Maybe keywords would do. Short words. Why do we need them? Okay, let's look at the results. Okay, you have your glucose, main source, ATP. What's AT? Okay, maybe let's close this. Okay, so in order for that to answer, let's go back to the PowerPoint presentation. Uh, so carbohydrates, generally the ones coming from the diet, its primary function is to provide energy. So it's our main energy source, as what you have learned before, such that um, the types of carbohydrates coming from the diet can also be classified in a similar way as what you have learned before. So they can be classified either as monosaccharides, disaccharides, polysaccharides, and your fibers. Now, just take note that uh, there are links between obesity or overnutrition and carbohydrate consumption. Now, this is together with the intake of calorie dense foods. When we say calorie dense foods, these are foods that are very high in calories per grams, coupled together with inactive lifestyle. So this is very prominent right now, especially right now during the pandemic, wherein we are very sedentary. Okay, so we just eat, and eat, and eat. Okay, so monosaccharides. So examples again, you have your glucose and fructose, which are primarily found in fruits, sweet corn, corn syrup, and honey. And take note, there is a special type of sweetener that we use, which is the high fructose corn syrup. So this one, they previously made this, or they modified this syrup, because as what you've learned before, right? Syrup, or what you call as your sucrose, your table sugar, which is our main sweetener. What would be the components of your sucrose? Which monosaccharides? Do you remember?
Glucose and fructose.
Okay, it's your glucose and fructose. Now, what they did is they tried to modify they tried to modify the component of that. So they lowered down the glucose content, And then what they did is they converted some of the glucose into fructose. Thereby, we have your high fructose corn syrup. So they used this as a substitute for sucrose as a sweetening agent. However, what they found out is that there's actually no difference between your sucrose and your high fructose corn syrup in terms of increasing the blood glucose after eating. So in other words, their effects are the same. So for the disaccharides, you have this sucrose, lactose, and maltose. Okay, we break them down into their monomeric components, after which are absorbed in our body. Okay, for the complex polysaccharides, so usually these are the bulk of what we eat, the complex polysaccharides. So these are your polymers of your monosaccharides. Most common would be glucose. Example of complex carbohydrates would be starch and glycogen. So these are the sources of starch coming from the plants, and then the glycogen would be the ones coming from animals, and as well as the ones stored in our body. Okay, another one would be the fibers. So for the fibers, these are your non-digestible, non-starch carbohydrates. So in other words, when we take it in, our body cannot break it down and be absorbed. Okay. Now we have such a thing as what we call as your soluble fibers, or these are edible plant parts that are not digested in our body, but rather once it reaches the colon, it is fermented and broken down by the colonic bacteria. Okay. So in other books, this is what we call as your probiotics. Are you familiar with prebiotics rather. Are you familiar with prebiotics? Yes or
Yes,
no? Yes. So prebiotics, generally these are your fibers because it causes the proliferation of our good bacteria in our colon. Now take note, it does not give us energy because it's not broken down, but rather its main purpose would be the following. So it number one, it lowers down the LDL in our diet or in our blood, okay, by causing excretion of our bile acids, and at the same time, it also provides bulk to our diet. So what do we mean by that? So if you are familiar with some of the weight loss regimens, diba? One of the things that they would do is they would suggest or recommend for us to take in lots of fibers. Now, the purpose of this is when we take it in together with water, take note, this should be taken together with water, it would expand. These fibers would somehow expand and swell. And by doing so, it would stretch our GI mucosa. We feel fuller, or in other words, we tend to eat less because of that. And by doing so, if we eat less, we are also losing weight. Okay, that would be the purpose of our fibers. But take note, in order for it to work, it must be taken together with water. Okay, I'm sure you're familiar with this, your glycemic index. So this tells us how much of the carbohydrate that we eat is being hydrolyzed. So the higher the glycemic index, the better it is hydrolyzed and absorbed. And then the lower it is resistant to hydrolysis and absorption. Okay. So take note, these are the example of carbohydrates that have an index of 1, so high glycemic index. And an example of a low glycemic index would be the non-starch polysaccharides or the fibers. Okay. Okay. Um, between the macronutrients I've mentioned, there is actually no direct evidence that will tell us that the consumption of simple sugars, example, glucose per se, is harmful. However, the only thing that they were able to link is that the formation of dental caries in children. Okay, the one I've shown you earlier that links carbohydrates with obesity is if it is together with other risk factors like inactive lifestyle. However, as a carbohydrate itself versus other diseases, there is no direct link. Okay. Now, take note that our carbohydrates, when we take it in, would provide 4 kilocalories of energy per gram of carbohydrate taken in. Okay. Now, when we take in excess of these carbohydrates, okay, it would result to lipogenesis. Okay, let's go back to the VVOX. Okay. Um, so give one role of dietary lipids. So what would be the purpose of this dietary lipids? Okay, storage, energy. What else? Flavor. Okay. Okay, good, good. Flavor, yeah, yeah. Um, okay. No more. Immunity in what sense? Digestion, absorption. Okay. All right. Sige, I'll close this. Okay. Okay. So majority of you answered source of energy or provides energy. Okay. Uh Sige. Let's go back to the PowerPoint. Okay, so dietary fats. So majority of you answered it provides energy. And what else? Storage. Okay. Um, wait, I forgot. Let's just share this first. Yeah, there. Okay. So energy. Yeah, interestingly, flavor. What do you mean by flavor here? Who answered flavor? Anyone who answered flavor? Actually, it is correct. Flavor. So uh some of the food that we eat actually are more flavorful if it's because of the presence of certain fatty acids. Okay, it makes it more flavorful or palatable to our senses. Another thing is satiety. So a high fat meal, I think you will learn this in physiology. A high fat meal would decrease the motility of our gastrointestinal tract. Okay, thereby making it uh, more more full. We have this sense that makes it more full. Okay, so we tend to eat less. Okay, okay. The others are somewhat self-explanatory. Okay, now for the dietary lipids, there is a direct link between your intake or of dietary fats and the increased risk for coronary heart disease, especially the level of our cholesterol. Okay, now your this condition, hypercholesterolemia, high levels of cholesterol plus high levels of LDL, increases the risk for coronary heart disease. However, this is together with other risk factors as well, such as smoking, obesity, sedentary lifestyle, and diabetes or insulin resistance. However, an increased level of HDL would actually decrease our risk for coronary heart disease. Now, when we want to change our lipoprotein levels, our LDL and HDL, it can be done by number one, changing the diet. So we can lower down the fat and carbohydrate intake, and as well as we can take in drugs that would lower down our lipoproteins. Okay, so you have your tags or triacylglycerides. This is the most important class of dietary fatty acids. Remember that triacylglycerides are your esterified forms of your fatty acids. So you have your glycerol and then you have your fatty acids attached to it. Now, the more important aspect of your triglycerides would be the fatty acids, its component. Okay. So remember, you have your saturated versus unsaturated fatty acids, omega-3 and omega-6 fatty acid, and then the cis and trans configuration. So when we say saturated fatty acids, again, this do not contain any double bonds, so single bonds only. And this is associated with high levels of plasma cholesterol and LDL. So thereby, it increases the risk of coronary heart disease. So these are the most common sources of our saturated fatty acids. So your coconut oil would contain lots of myristic and lauric acid. Palm oils would contain lots of palmitic acids. Now, take note that our saturated fatty acids should be comprised or should not be greater than 10% of our total calories that we take in. So it should be less than 10%. Now, in contrast to your saturated would be the monounsaturated fatty acids. So mono meaning one double bond only. So this is derived from your some of the vegetable oils. Example would be olive oil. Now, the effects would be it lowers down the plasma cholesterol and LDL. However, not much of an effect in the HDL. Now, take note, the recommendation is this should be about 50% of the total fats that we take in. Okay. So later on, at the end of this lecture, we will look at how we do uh, nutritional prescription or dietary prescription. So we will compute for the amount of carbohydrates, lipids, and proteins that we need per day, and then for the lipids, 50% of that should be monounsaturated fatty acids. Okay, and then we also have your polyunsaturated fatty acids, so more than one double bond. This can either be the omega-3, your linolenic acid, or omega-6, your linoleic acid. So this would be the effects of your omega-6 and omega-3 fatty acids. Now, if you can remember, these two are your essential fatty acids. So essential. We need to take this from our diet. Okay? Because the main purpose of this omega-3 and omega-6 would be it is required for the fluidity of our plasma membranes, and it is required for the synthesis of uh, long chain unsaturated fatty acids. Example would be the eicosanoids. Okay. Um, are still with me? Am I going too fast or just right?
Right, doc.
Just right. Okay. So this is your omega-6 family. Omega-6, because if we count the number of carbons from the omega side, it would be at carbon number 6. This one. And then this one would be the omega-3. So from the omega side, it's at carbon number 3, the first double bond from the omega side. Okay, and then we have your trans fatty acid. fatty acids. So these are your unsaturated fatty acids that behave like your saturated fatty acids. Okay. So this one increases LDL and the risk for coronary heart disease. Now, this occur in small amounts in animals because in nature, the predominant form of unsaturated fatty acids would be the cis form or the cis configuration. However, after the baking process, for example, heating it and then cooling it down, what happens is it will change its configuration. From a cis configuration, it becomes the trans configuration. So if you can remember, this is the cis configuration. Cis would be same side, same side. So this is the naturally occurring unsaturated fatty acids. However, after commercial processes, what happens is it will change its conformation and become a trans. So the trans would be opposite sides. So this side, and then the next bond would be on the opposite side as well. Now, if we look at the trans configuration, it looks somewhat like your saturated fatty acid. Okay, so we do not want this. What we want would be the cis configuration. Now, there are other factors that would affect coronary heart disease, as what I mentioned earlier, aside from the lipids. So, you have your lifestyle, presence of obesity, what else? Uh, Smoking, and then another one would be alcohol consumption. Now, what they studies would show would be alcohol consumption would actually decrease the risk of coronary heart disease. However, it must be controlled because high levels of alcohol would be harmful to our liver. Okay, so it must be in moderation. And what do we mean by in moderation? So the recommendation is for women, it should be one drink per day, and for men, two drinks per day. Now, when we talk of drinks here, if it's a wine, it's usually one drink is equivalent to one glass of the wine glass, about 200 ml. And if it's a hard liquor, it's one shot, the 30 ml. For beers, it's bottle, the usual bottle of beer, about 300 ml, I think. So the recommendation is one for women and two drinks for men per day. Okay. Okay, so let's go back to the VVOX. Uh, okay, so this one, so give one example of an essential amino acid. So this is easy, right? They are essential amino acids. So you can type in your answers. Okay. Yeah. 10 more seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay. See. What was your mnemonic, or how do you remember for your essential amino acids? What was the mnemonic that you learned? Okay, before that, what are essential amino acids first? Anyone? Essential
That
amino
we get from
acids.
our diet.
Cannot be made by the
It
body.
cannot be made by the body.
Yeah,
Okay,
it's
it
get
cannot.
from outside, from live food.
from our diet, sir.
Okay. So these are your amino acids that are not synthesized in our body. Therefore, we need to take it from the diet. Okay. So we mainly get this from the dietary proteins. Okay. So actually, for the dietary proteins, there are no dietary requirements for proteins. However, the main purpose of our dietary proteins would be as a source of essential amino acids. Now, the quality of dietary proteins depend on the source. Okay, so its ability to provide essential amino acids. So they would say that animal sources would be of higher quality because it is able to provide more of the essential amino acids. And at the same time, it is more readily digested as compared to the plant sources, which is of lower quality, meaning to say its amount of essential amino acid is not that high. Okay. Okay, so when we talk of your essential amino acids, it's your private Tim Hall, right? So PVT Tim Hall. Okay. I think in your on your answers there is an incorrect here. Which one? Here, proline and glycine. It's not part. Okay. Proline and glycine are not examples of essential amino acids. Okay. Okay. One important concept with regards to our dietary proteins would be what we call as your nitrogen balance because these dietary proteins would provide the nitrogens, the nitrogen, majority of the nitrogen that we take in. Okay, so normally, for us adults, for a normal, healthy adult, let's say medical student, not an athlete, okay, the nitrogen intake should be equal to the nitrogen excreted. Okay, the one we excrete from in our urine. Okay, now there are conditions that would increase that would make the nitrogen balance more positive. When we say positive, the intake is greater than the excretion, or the excretion is very less compared to the amount of nitrogen taken in. Okay, so this conditions example would be during growth for children and babies and children and pregnancy. Okay. At the same time, on the other hand, rather, a negative nitrogen balance would entail uh, a decrease in intake. So this one is decreased, and this one is increased. Okay. So usually this is seen in conditions wherein patients are unable to eat. Example, after surgeries, in patients with cancer, or in conditions of nutritional disorders. Okay. Now take note, the recommendation for proteins, generally the recommended amount of protein would be around zero point 0.8 grams per kilogram per day. For athletes, it's a little bit higher, 1 gram per kilogram per day, and 2 gram per kilogram per day for infants. Now, the requirement for protein, as I've mentioned earlier, there is really not an exact recommendation for proteins because this would rely on the carbohydrate content of our body. So take note, if our intake of carbohydrates is less than 130 grams per day, okay, it would mean that our body would look for other sources of energy because it's not enough. The carbohydrate that we took in is not enough. So what happens here is that uh, a certain amount of protein would be metabolized, would undergo gluconeogenesis. And at the same time, excess proteins, what will happen is it will also be, aside from being excreted, it would also be metabolized to become uh, intermediates in gluconeogenesis. Okay. Sorry, is there a question? Questions? None? Yeah, I think not. Okay, so let's proceed to the next question. So, so please answer which is not a feature of marasmus. So when we say marasmus, this is under your malnutrition, protein energy malnutrition. Let's look at the answer. Okay, so it's between edema and unequal distribution of hair. Of course, the answer is not malnutrition because I've mentioned it. So it's not, marasmus is an example of malnutrition. So this is already wrong, incorrect. Okay, so let's look at, or I'll close this, and then let's look at the protein energy malnutrition. Okay, so when we say protein energy malnutrition, what happens here is that there is inadequate intake or over intake of proteins and energy. So usually this may affect the immune system, which may result to recurrent infection. Okay, so there are forms of protein energy malnutrition. So the first two would be the undernutrition, kwashiorkor and marasmus. And the third one would be overnutrition. Okay. So in kwashiorkor, what happens here is that the protein deprivation is greater than the inadequacy of calories. So this usually occurs in individuals whose diet would only be composed of carbohydrates only. So for example, children who are not eat or who's only eating cereals and rice, carbohydrates only. So the symptoms would be stunted growth, skin lesions, depigmented hair, enlarged fatty liver, and edema. Now the edema here is because of the decreased synthesis of visceral proteins. Example would be albumin. So there would be a decrease in oncotic pressure in the blood, capillary oncotic pressure. So as a result, fluid now shifts towards the interstitium, resulting to edema. The other type would be the one I asked you would be the marasmus. In marasmus, this is a condition wherein both proteins and carbohydrates are inadequate. So symptoms would be the following: arrested growth, extreme muscle wasting, and loss of subcutaneous fats. Okay, and they do not show edema. Okay, so just to compare kwashiorkor and marasmus. So this is kwashiorkor. So very prominent, the abdominal edema is more prominent in kwashiorkor compared to marasmus. So here, this is what? Kwashiorkor or marasmus?
Kwashiorkor.
This is okay. This is kwashiorkor because of the edema in the abdomen, as compared to the other one, which is marasmus. Here, okay. The other type would be overnutrition. So in overnutrition, so usually this is um, a result of excessive intake of calories and protein. So usually They would look like as heavy-looking individual. There would be adiposity in the mammary regions and fat deposition in arms and thighs. Okay, so this is, for example, Spider-Man during the pandemic, he becomes obese. Okay. So in order to prevent this, we have to eat a balanced diet and regular exercise. But it's easier said than done, right? Okay, now let's look at the reference intakes. So these are your estimates of the amount of nutrients required to prevent deficiencies and maintain optimal health and growth. Now this is based on certain age groups, physiologic states, and gender. So these are the example of your dietary reference intakes. So these are like uh, a table of values that we look at in order for us to determine if there is undernutrition or overnutrition. Okay, so let's look at the differences. So when we say estimated average requirement, the keyword here is average, meaning 50% of the population for a certain specific age and gender group, as compared to the RDA, the recommended dietary allowance, which is approximately all, so 97 to 98% of the population. So between the two, the more accurate would be RDA because it's for approximately all. Okay. The adequate intake, on the other hand, is a set of reference intake that is usually set if there is insufficient RDA. For example, breast milk, because not everyone would need breast milk, only the infants. And then we also have the upper level, the tolerable upper intake level. So this is the highest nutrient intake level, which will not result to an adverse effect. Okay, so important thing in looking at nutrition would be to calculate for the ideal body weight. Now, there are several ways to estimate for the ideal body weight. Number one, we can get it from the BMI. You know how to compute for BMI, right? Everyone? Yes or no?
Not
Yes,
exactly,
doctor.
doctor.
Yeah, yes. Okay.
Yes.
BMI is body mass index, right? So it's weight divided by the height in height squared in meters. Okay. So you have to just get the normal BMI and then multiply it by the height of the individual, and then you'll get the ideal body weight. Okay. Fast way is we can approximate it. So height in centimeters minus 100. For example, for me, uh, I'm 165 centimeters, so less 100, that would be 65. So approximately my ideal body weight should be around 65 kilograms. Okay, but to compute for it more accurately, we have this formula. Okay, so for females, this would be the formula. So if the individual is 5 feet, okay, automatically the ideal should be 100 pounds. And then you just add 5 pounds for every inch over 5 feet for females. For males, the ideal would be 106 for 5 feet, and then you add 6 pounds for every inch over 5 feet. So, for example, for me, I'm 5'5". So, my ideal uh, body weight would be 106 plus 6 times 5, 30 pounds. So, 136 pounds. Okay, clear? So after this, you compute for your ideal body weight and see if it's within your current body weight. Now, another thing that we look at nutrition would be weight loss. So, for weight loss, it is appropriate to compare the current weight with the usual weight, not with the ideal body weight. Okay. Now, generally, when we define weight loss, it would be this one. So we will only say that it is significant is if after a month there is a 5% decrease in our weight, or in 6 months there would be a 10% decrease in our weight. So we do not want the severe weight loss because it might predispose us to other clinical conditions. Okay, another thing that we look at nutrition would be we compute for the requirements. Okay, number one would be we compute for the estimated energy requirement. So this is the average intake that is predicted to maintain an energy balance. So this is what we require in order for us not to have any deficiency or excess in calories. Okay, so the approximation is like this. So we just multiply the body weight with depending on our activity. So for example, right now, I'm sure majority of us are in sedentary lifestyle. So we just multiply our body weight with this factor. So 30. Okay. So compute for your energy requirement right now. Okay. Uh, in relation to energy requirement is what we call as your total energy expenditure. So this is the amount of energy that we spend per day. Now take note that in order to prevent deficiencies or excess, our intake of calories, our requirement should be equal to what we spend, okay, in order to maintain our weight. Now, if the intake is less than what we spend, there would be weight loss. If there is the intake is greater than what we spend, there would be weight gain. Okay. Now, this total energy expenditure is the energy generated that is needed in what we call as your energy requiring processes. And what are these? You have your resting metabolic rate. So we have the energy that we use in order to perform our physical activities and the thermic effect of food. So for the resting metabolic rate, so this is the energy that we need uh, in order to perform our physiologic functions, bodily functions. Example would be respiration, pumping of the heart, flowing of blood, etc. So this is approximately 50 to 70% of our total energy expenditure. And in order to calculate for this, the factor is 24 kilocalories per day per kilogram. So approximately is equivalent to 24 multiplied by our body weight. Okay, so in some books, there is what we call as your corrected resting metabolic rate. So you just subtract 10% of the resting metabolic rate that we compute. Now, in order to calculate, because this one is just an approximation. In order to really calculate our resting metabolic rate, there is what we call as your Harris-Benedict equation. So it's a formula that would accurately compute for our resting metabolic rate. Okay, but of course, I'm not asking you to memorize this. This would be enough, the 24. Okay. Another thing is the amount of energy that we need for our physical activities. So this is approximately 30 to 50% of our total energy expenditure. And then take note to compute, it would be the following. So depending on the physical activity, we just add 10%, 30%, 50%, 75%, or 100% of our calculated resting metabolic rate to our resting metabolic rate. So for example, what we got is 1,500 of our resting metabolic rate. So if we are on bed rest, our total energy expenditure would be 1,500 plus 10% of 1,500. What's 10% of 1,500? 150. So our total energy expenditure for if we are on bed rest would be 1,650 calories. Did you get me? Yes
Yes,
or
Doc.
no? Yes, okay. And then we have the thermic effect of food. So this is the amount of energy needed during digestion and absorption. So if we are to make a pie chart, this is how it looks like. So our total energy would be approximately 60% used in the resting metabolic rate, and then followed by the physical activity and then the thermic effect. Now, we also have your acceptable macronutrient distribution ranges. So this is the range of intakes for a particular macronutrient which is needed in order to reduce risk of chronic diseases. So for example, for carbohydrates, we set it at 60%, 45 to 65%. We set it as 60% of our total diet. So meaning to say 60% of our diet should be carbohydrates. For fats, it should be around 20 to 35%. And then for proteins, it's 10 to 35%, depending on what we need. Okay, so this is an example of the reference that I've mentioned earlier, your recommended dietary allowance. Or in this case, it's the recommended energy and nutrient intakes. It's somewhat the same. So this is for uh, you have here the different minerals and vitamins as well as the energy needed per age group and per gender. Okay, so let's go back to this last part. So go back to your VVOX. So a healthy 30-year-old man weighing 80 kilograms and engage in light activity. So how do you compute for his EER? So what would be the formula? Okay, so let's see the answer. Okay, so the keyword here is light activity. So when we talk of light activity, the factor is 30 kilocalories per kilogram per day. So it's this one. So his EER should be around 2,400 kilocalories per day. Okay, good. So this is for moderate, and this is for active lifestyle. Okay. Okay, next. So that would be the correct answer. Okay, next. So same. 30-year-old man weighing 80 kilograms and engage in light activity. So how do you compute for his resting metabolic rate? What would be the factor?
42.
Okay, this one is incorrect. The 2,400, it's incorrect. That would be the estimated energy requirement for this individual, but it's not the resting metabolic rate. Okay, so okay, I'll stop this. So this is correct, 24. So the factor is, or to get the RMR, you have the body weight, multiply it by 24 kilocalories per kilogram per day. Okay, very good. Okay, next. So this one, same person, compute for his protein requirement in grams. Or maybe you can put what the factor for proteins. Okay, no one's answering. I think you miss it out. Okay, very good. It's 0.8 grams grams per kilogram per day. Okay, it's 0.8. Okay, very good. So 64. Okay. Okay, I'll stop this. Let's proceed to the next question. I know, this is the last. Anyway, sige. Let's go back to the PowerPoint. Okay. Last part of that is you've computed for the proteins. You also have to compute for the carbohydrates and fats per day. So let's look at this. So same patient. So for the AER, everyone got this right. It's 2,400 kilocalories. Okay. For the RMR, you multiply it by 24. So it's approximately 1,920 kilocalories. And then in order to determine the total caloric requirement or total energy expenditure, you also have to compute for the energy required due to his physical activity. So this is light activity. So going back to the factor, it's around 50% of the RMR. So meaning to say 960 kilocalories should be attributed to his physical activities. Now, in order to get the total energy expenditure, you add the RMR and physical activity. So the total energy expenditure would be approximately 2,880 kilocalories. Okay? Now, this TEE would be the basis of how much carbohydrates, fats, and proteins we are giving to our patient or to this individual. So in order to determine the proteins, okay, it's approximately 0.8 grams per kilogram. I don't I yeah, it's 0.8, not 1. That's why I am incorrect here. It's zero point 0.8 to be accurate. Okay. But in some cases, in other books, in order for people to remember it, you just get 1 gram per kilogram. So this it would be enough as well. Okay, so it would be approximately 80 grams. So 64 to 80 grams of proteins per day. Now, to get the uh, calories equivalent to your proteins, you just multiply the conversion. Diba? If you can remember, for carbohydrates and proteins, it's 4 kilocalories per gram. For fats, it's 9 kilocalories per gram. Okay, so you in order to just get the caloric equivalent of this 80 grams, you just multiply it by 4. I sorry, why is it 240? It should be 320. Okay? 320. Okay. So to get the carbohydrates, okay? So in order to determine the amount of carbohydrates, you just get the 60% of the total energy expenditure. So meaning to say, the total energy expenditure, we need 2,880 of calories coming from the diet. And 60% of this should be provided by carbohydrates. So you just get it. So multiply it by 0.6, meaning to say 1,728 should be calories should come from your carbohydrates. Now, in order to determine the weight or grams of this one, you divide it by the conversion factor, which is 4 kilocalories per gram. Okay, so it should be 432 uh, grams of carbohydrate per day. Okay? Did you get me for this one?
Yes,
Yes
sir.
or no? Yes. And then for the last one, we have to compute for the fats. So this one, you just have to subtract the calories provided by carbohydrates and proteins from the total energy expenditure. So I think this is an error because this should be 320. So 320 plus 1728. Okay, minus 10. Okay, so it should be 832. 832 kilocalories. Okay, did you get the same answer? Yes or no?
Yes.
Yes,
Yes.
sir.
So this one is provided by
Yes,
carbohydrates,
sir.
this one by proteins, and then this one will be the calories provided by the fats. So 832. Okay. And then in order to get the weight of that, you divide it by 9 kilocalories per gram. So 832 divided by 9, that should be around 92. Okay, so 92 grams of fats per day. 50% of which should be monounsaturated. So about 45 grams of that should be your monounsaturated fatty acids. Okay, did you get this one?
Yes, sir.
Yes, sir.
Yes. Okay. So do you have any questions?